morning, everyone, and welcome to this webinar. I'm Dr. Lendaro, and in this session, I will introduce the concept of function-driven orthodontics and the use of the gunmetal wire. Very often, orthodontic treatment focuses only on dental alignment, while function, unfortunately, is not considered a primary treatment objective. We will explore the importance of the masticatory organ, not only from a local perspective, but also from a systemic one. And we will see how to treat also severe malocclusion with the use of gunmetal wire and without surgery and without premolar extraction and respecting the complex functions of the masticatory organ. But before we begin, let me introduce myself. I'm an Italian dentist working in a small city in northeastern Italy called Udine. Throughout my professional career, I have had the opportunity to meet many professionals who have helped me grow in my work life. I would first like to thank and remember Dr. Marco Redana, who has been a great friend and a mentor to me. And thanks to him, I had the opportunity to meet and attend for over 10 years with Professor Slavicek and Professor Sato, who have been fundamental in my profession. At the same time, I continued my education by attending many courses on diagnostics, functional therapy, myofunctional therapy, in sleep dentistry, in rehabilitation, and neuroscience. But now, let the webinar begin. First of all, what do I mean by the term of function-driven orthodontics? Function-driven orthodontics is an orthodontic vision based both from a diagnostic and therapeutic point of view on the search for correct function of the craniocervical system, the body posture, and the brain health. The masticatory organ is a cybernetic system, and it is one of the most complex and nonlinear systems of the human being. It has multiple functions. According to Slavicek and Sato, the main functions of the masticatory organ are mastication, speech, swallow, breathe, and stress management. But for me, there are two more important functions, which are posture and brain health. I know that there is not a consensus about it, but I strongly believe in it, and there are also a lot of scientific papers supporting this thesis. We cannot think that the masticatory organ is completely separate from the whole body without any connection. And now I would like to show you some scientific articles that support what I have told you. For example, there are a lot of articles, including literature reviews, that indicate a relationship between occlusion, chewing, and cognitive functions. There are tons of articles on this topic. And in this review, it is stated that mastication and other movements stimulate the activity in the cerebral cortex and may be helpful in preventing degradation of a brain function. This is very, very important. And other articles that relate occlusion disharmony and reduction of neuronal proliferation and loss of dental elements and loss of brain volume. Again, articles that relate the occlusion disharmony increase the production of beta amyloid substance, and the tooth loss triggers the progression of the Alzheimer's disease. And in this article by Greven and Sato, it is highlighted how there is a correlation between the severity of malocclusion, the joint position, and brain activation, also stating that we can assess the severity of malocclusion by evaluating the brain aspect as well. This is very important because for the first time, the severity of malocclusion is not only the severity of class 2, of class 3, of lateral deviation, but also by evaluating the brain aspect. And this systematic review with meta-analysis show a correlation between posture and TMD, of temporal mandibular disorder. This is the first time, the first systematic review. There are still many articles in literature, including a literature review, that highlight a relationship between occlusions and scoliosis. In particular, has been observed that these correlations are significant in cases of class 2 with lateral deviation. And in this systematic review, we can find 131 articles conclude that the occlusion affects posture, and 171 assert that posture affects occlusion. Let's go ahead. A soft diet is a major problem in dentistry as it leads to reduced craniofacial development, as demonstrated by studies by Lieberman and others. However, not everyone knows that a soft diet can inhibit neurogenesis and neuronal transmission at the brain level. Another very common problem in the modern population is mouth breathing, which has many implications at the oral level, and it contributes to numerous malocclusions. Patients who breathe through their mouth frequently suffer from nighttime snoring and obstructive sleep apnea, and very often dentists are the first to notice. These problems are also closely related to the development of ADHD syndrome. Furthermore, there are studies on tooth loss and hypertension, diabetes, liver disease, cancer, and stroke. Therefore, there is ample evidence that the mouth has multiple interactions with the entire organism. That's why, to avoid problems, we must start and go in deep with diagnosis, and especially in functional diagnosis. Even Sato, in his book, say that the use of mu is only significant once a treatment plan has been established based on the understanding of the malocclusion and its accurate diagnosis. So, in my opinion, we have to do not only the classical basic analysis before an orthodontic treatment, with casts, pictures, X-ray, but also with the deep functional analysis of the masticatory organ and, if it's possible, of the posture of the patient. And nowadays we have a lot of ways to do it. After, we have to do a functional driven treatment, and we will see after some cases. And of course, the control and the functional treatment control. So that means that our treatment is the consequence of a deep diagnosis, because if you know where you are, it's easy to define where you are going. So if we know where we are, that means diagnosis, and we know which is our functional treatment objective, we can use different appliances, we can use different techniques. So why I use multi-loop technique with a GUMMETAL? Because this technique allows me to obtain a management of the torque, a management of the tip, practically tooth by tooth, a management of vertical dimension, and the management of the occlusal plane. And these are very important points in the treatment of malocclusions. And a management of the compensating curves, and a management of the expansion. And above all, it allows me to do it symmetrically, but also and especially asymmetrically. because the more you go in deep with the analysis, the more you see asymmetric cases, the more you see asymmetric malocclusions. That means I need a technique that allows me to work asymmetrically. Before, I used the algiloid blue wire for the mu, and now I have switched to the gunmetal wire. Why? Because at the same time, I have the same mechanical effects, but it's very easy to bend. So I have reduced my chair time. I don't need to do heat treatment, and is very much more accepted by the patient also for the cleaning. Gunmetal is a new titanium alloy developed by Toyota Labs. It's a wire with a very unique mechanical characteristics because it has a high elasticity with the ultra low Young's modulus, and at the same time it is super strength and super plastic. That means you can easily bend it. But now let's start with some cases. This is what I call all-in-one malocclusion because as you can see, we have the left lateral deviation of the mandible, we have a agenesis of the upper right lateral incisor, and the left one is conoid. The second lower left premolar was extracted, and the molars are meso-inclined with loss of vertical dimension and temporomandibular disorder. This patient had a bilateral lock, as you can see from the axiography, and axiographic analysis is not needed to diagnose an articular lock, and the patient simply could not open more than, in this case, 2.5 centimeters. As can also be seen in the masticatory pattern, this patient had a bilateral chewing, but it was pathological because the movement goes too much backward due to the overbite and the retro inclination of the incisor, which negatively affects the joint. An emergency splint was performed in this case, and this allowed to unlocking the joint movement. And after that, an orthodontic treatment was performed by reopening spaces, restoring verticality, which is very, very important, and recentering the mandible. And now you can see the final result also from an axiographic point of view with a good movement. Not only with the reopening of the spaces for the teeth and the reduction of the overbite, we gave the system the possibility to achieve a bilateral, but in this case not pathological, chewing pattern, as you can see on your right side. Now another case, and we can see another severe, very severe malocclusion with a left lateral deviation of the mandible and open bite and class 3 malocclusion and with a left cross bite. The therapeutic approach with a gunmetal wire for a 3D management of malocclusion, as you can see in the pictures. I also put a mulligan, which is an overlay wire for improve the enlargement of the upper arch. You can also see that I use only a left elastic in order to promote more the expansion on the right side. Also, if I have a left crossbite, this is to permit the readaptation of the mandible, because if you center the mandible, you can see the problem is not on the left side, but on the right side. Here the improvement of malocclusion, and you can see on the left, I have cut the wire in order to improve the vertical dimension. And here is the case before and after. Another case with class 2 malocclusion with mandibular right lateral deviation and anterior wall. As you can see here, the lower incisors are into the palate mucosa, and you can see also the impression of the upper incisal edge on the lower lip. Here is the complete case of bilateral class 2 with right lateral deviation. The palate is in bilateral internal rotation, but you can see that it's still asymmetric, with the left side more internally rotated than the right, and in the mandibular arch as well. Associated with this, you can see a tight tongue with a short frenulum, which was cut with a laser. The tongue was retrained with myofunctional exercises and a froggy mouth. When the function, and in this case I talk about the swallowing and tongue position in rest, and the mechanics goes in the same direction, you can see the result and the different shape of the upper arch in only 4 months. I use steps in order to improve vertical dimension, but being an asymmetric malocclusion, it requires asymmetric activation. As you can see here on the picture, the steps on the right side are greater than those on the left side. And this is the complete case with the mandible recentered, the increase in vertical dimension, and the consequent reduction of the overbite. The reduction of the overbite was obtained not with the intrusion of the incisors, but with the improvement of the vertical dimension and asymmetric improvement of vertical dimension. And you can see also how the palate has become symmetrical. Another case of all-in-one malocclusion. This is an extreme case, and this patient had 25 years of fixed orthodontic treatment before. And this is the result. We have a severe lateral deviation on the left side, an open bite, a cross bite, and in the upper jaw we have two premolars extraction. Also, from a functional point of view, we have some problem. She has temporomandibular disorder, and you can see here a mastication pattern. You see an inverse and fixed monolateral chewing pattern. A three-dimensional management and the treatment of malocclusion using gunmetal wire. With this wire, I can control a lot of parameters at the same time: the enlargement, the verticality, the occlusal plane, the torque, and the tips of all the teeth. And you can see here, this is before and this is after. And this is from occlusal point of view, and this is from a functional point of view. Before, if you remember, she was able to chew only on the left side, but now she can chew bilaterally. To achieve this result, it's important to combine orthodontics with functional exercises for chewing. Another case with a severe lateral deviation of the mandible, with a tilted frontal occlusal plane, with a lack of vertical dimension on the left side and a palatal contraction. Also, this case was treated with multi-loop technique and GUMMETAL, and also in this case we have an asymmetric malocclusion. So we have to put asymmetric information on the wire. You can see here on the left side we have bigger steps to gain more verticality and flatten the occlusal plane. And I put also coronolingual torque. On the right side, we have a greater expansion and a coronovestibular torque. Here you can see the improvement of malocclusion and the space for the lower jaw recentering on the right side. And this is the final result of the occlusion. Now, the last case, you see here a severe, very severe class 2 malocclusion high angle with a strong crowding, open bite, and increased overjet and a severe palatal contraction. And also in this extreme case, the GUMMETAL allow me to manage all the parameters of the malocclusion, the verticality, the occlusal plane, the crowding, the palatal contraction. And you see here the result in dental arch reshaping from the beginning to the end of the treatment. And this is the result both in dental occlusion and in skeletal morphologies. This was before, this was during the treatment. You can see the improvement also from a skeletal point of view, and this is the end of the treatment after the bonding. I hope I've been able to show you things from a different point of view. And these are my conclusions and take-home messages. First of all, think functionally. After that, go in deep in diagnosis and very, very important in functional diagnosis. After, treat as early as possible and customize your treatments. And great help in treatment comes from the use of GUMMETAL, which is a high-performance wire that allows us to treat also severe malocclusions. And with this kind of mechanic approach, the GUMMETAL wire permits us to work also in a symmetric way, which is very, very important. And above all, with a functional approach. Apologizing for my spaghetti English, I greet you and I thank you very much for your kind attention. Always keep in mind this phrase from Professor Slavicek who says, use your brain, it's free. Thank you very much again and let the function be with you. Ciao!